Well, for people released from prison in this province, reintegration into society can be a challenge, but it is significantly more difficult for former inmates who struggle with addiction or mental health issues. Well, according to a new study, about 70% of those inmates end up back in prison within 3 years. And joining us now to tell us more about that and the reasons behind it, Amanda Butler is with us. She's the lead author of the study and an assistant criminology professor at Simon Fraser University. Good morning to you, Amanda.
Good morning, Stephen. Thanks for having me.
Oh, thanks for taking the time with us. We appreciate it. So walk us through it. Exactly what did your study find in regard to people who are released from jail who have addiction and mental health issues?
So, our study looked at all adults who were incarcerated in the provincial system, so any one of the BC provincial correctional facilities over a 2 year period. And then they were followed for 3 years after that incarceration. And what we found is that people who have mental health and substance use disorders, or what we call co occurring disorders, were the most likely to return to custody in the 3 year period and also return to custody the quickest. So they had the fewest days in community before returning to custody. So nearly 3/4 of people with co occurring disorders will have returned to custody within the 3 years. And there's a really big gap between that group and folks that either had no disorder at all or mental disorder alone. So
Hmm.
that's non-substance related mental disorders.
And so how big is that gap then?
So people with mental health needs alone, just over half will have returned to custody in the 3 years, and 49% of people with no disorder will have returned. So
Wow.
return to custody is pretty common among everyone, but there's a significant difference between people who have substance use disorders and those who do not.
And so we know that people with those substance use disorders are far more likely to end up back in jail. Do we know specifically why? Does it have to do with generally drug offenses or is it something else?
So it's actually generally not drug offenses. So in other work that we've done, we've controlled for the type of offense, and the trends remain the same. So we can't explain with the data that we have exactly why this is happening, but we have some ideas, and other literature supports this as well. But when you look at the cohort characteristics, what you see is that people who have substance use disorders are also more likely to have a whole host of other what we call criminogenic risk factors, or other factors that will increase their likelihood of being involved with the criminal justice system. So things like low education, so not graduating high school, being unemployed or underemployed, not having any family support or social support, having other types of kind of clinical complexities like brain injury. So it's not just the substance use, it's a lot of other things going on.
Hmm. And tell me a little bit then about the methodology. I mean, you took an awful lot into account here, as you've just outlined.
Yeah, so we were really fortunate to be able to access data from the BC Corrections system. So we applied to BC Corrections, which is the government authority responsible for adult custody in the province,
Hmm.
and we asked for access to all of the intake screeners. So every adult who's admitted to provincial custody goes through what's called the jail screening assessment tool, and it's a universal, validated tool that collects lots of information about people's health, their mental health, their substance use, their family support, violence risk, all of those things. And it's a correctional management tool, but it contains a lot of really important information. And so we saw this as a great opportunity to use that information for research purposes, and we were able to get those data to do the study.
And of course, there might be a perception out there that people who have these sorts of substance use issues are, I mean, they're very difficult to rehabilitate, or some people might even think, they can't be rehabilitated. They're in prison once, they're going to be back over and over again. Does this study reinforce that notion or that, I guess, stigma?
Yeah, so I think that we need to be really careful about how we have these conversations. It's important for us to be aware of the way that people with mental health and substance use are impacted by stigma and the discrimination and barriers they face in our communities. These data should be interpreted as seeing that our systems of care, our services in our communities, are not working, that we're failing a major group of people within our communities. And we've known for a long time that historically substance use care has been underfunded. We're still in a position where we really don't have a substance use system of care in this province. And so that's the data really should be used to advocate for building strong and
Mm.
robust and well-resourced communities to ensure that people can actually get their needs met.